Welcome to the second episode of Aesthetic Talks. I am Ivan, the co-founder of Aesthetic Links, the first platform which helps you find the best aesthetic clinics based on word of mouth and genuine rating. Today, we're very honored to have Dr. Tenorio with us from Geneva. Enjoy. Dr. Tenorio, welcome. How are you doing today?
I'm doing fantastic. Very happy to be here.
Thank you for the honor of coming. Please introduce yourself for our guest.
So my name is Javier Tenorio. I'm a plastic surgeon. I'm Ecuadorian from origin. I studied medicine in Ecuador and I did my specialty in plastic surgery in Switzerland.
It's amazing. Your first plastician on the episode, so I'm super excited. Loads of questions that are going to come.
Bring it on. I love it. I love it.
So tell us about your clinics, how it started. When did you open your first clinics? How many you have now?
Okay, this is a love story, Ivan. Everything started with my traineeship in Switzerland. And I met my wife when I was a student. And then she said, I'm going to marry a potential plastic surgeon in the future. I hope she's not listening to this. Immediately after I finished, I opened my first clinic in Geneva. It was a very good decision to create or start creating at the time the operation room, the technical base. And that gave me a catapult to be able to be independent in doing the plastic surgery and the cosmetic procedures practice, because we lose very little dependence in other hospitals and other clinics. And that paid very well. We were able to develop the surgical bit. At the same time, we were able to develop the clinical or the aesthetic part that is not invasive. I bought my first laser and then another one, and then I started to add technology. When I was strong enough to expand, I opened my first office in Gstaad. It was a planetary alliance that ended up with an invitation for me to open a cosmetic clinic in a big 5-star palace.
And that's super rare, right? There aren't many clinics up there.
Yes, I was the very first one. And that bring me to another fantastic adventure in meeting phenomenal people and gave us another position in cosmetic procedures in Switzerland. That took us to have, the force, the energy to create another one in Montreux. So we opened another one in the Montreux Palace. After a while, I was asked by officials in other nations to help them to create the services of plastic surgery. So I gave a hand in creating plastic surgery and helping to develop in Qatar, where I have a license as well. And I work as a consultant for other cosmetic clinics and other cosmetic services. So it's been a beautiful journey. Right now we have 5 practices, 2 in Geneva. We have our surgical room in Geneva and another consultation center in Rue du Rhône. That is absolutely amazing. It's new. Please come and visit.
Yeah.
We still have Montreux. We still have Gstaad that is developing very well. And we have this consultation system in Doha, in Qatar.
Okay, very nice.
So coming to Dubai from time to time as well, giving advices, technical advices. So, it's a wonderful journey.
Question that's really outside the field, but how many hours per day do you work? Because you have so many clinics and such a packed agenda.
Yeah, but it's as any normal person. I work 12, 13 hours a day. I don't think that I work in reality. I follow my passion. That brings a lot of results, as you're following any passion, with a lot of energy. And I don't really consider it work, but I give a lot of time to follow my passions.
That's super nice. Talking about passion, what led you to start this career? What was the little element that made you say, this is what I want to do?
Well, that's a very interesting question. And I'm going to be super transparent with you, because studying medicine was something that it was influenced a lot by my father. I think that my dad wanted to be a doctor, but he didn't. My grandfather was a doctor. His father was a doctor. So when I was young, he was always told me, you like to do a doctor when you will be a grown up, you will like to study medicine. So little by little, he brainwashed me. And I accepted to do medicine at the time. But I was not really sure that that would be a good outcome because I was a very creative person. I am a very creative person. And I had also passions for maths. And I think that I could be a good architect, a good engineer, a good builder, or I was very good in systems as well, in computers at the time. But I gave it a try in medicine. And when I was doing medical school, the hospital where I was training were looking for translators for a mission of American plastic surgeons, American and Canadian plastic surgeons that went to Ecuador to operate cleft lip and cleft palate, these babies that have these deformities in the lips, the palate, and the nose. And I signed in as a translator. And amazingly, when I went to my first surgery and you have a baby that it has a serious deformation in the face and is fixed in the space of 1 hour and a half, re-included in society, reinserted in escolarization, reinserted in the family, I said, oh my God, this is what I'm going to do. And then from that moment over, I was probably 19 or 20, I decided that I will be a plastic surgeon. And I became a plastic surgeon.
That's amazing. That's really a nice story. Now that we've discussed about your clinic, let's jump into treatments because this is what viewers are expecting the most out of this episode. And as I said, you're the first plastic surgeon that we have on the podcast. So I have a few questions and I'd like to hear your thoughts on a few treatments, maybe some anecdotes that you might have. And maybe why don't we start with lipo transfer? First of all, what is it for viewers that wouldn't know what it is? It's a word that we hear a lot, that we can read some on internet, and I'd like to learn a bit more about it.
Okay, Ivan. Lipo transfer is magic. It's absolute magic. Literally, is take fat from a place that you don't want and put it in a place where you want. So it is absolutely magic. Now, in what concerns fat transplantation and body contour, we do a lot of bumps. The famous VVL. We can remove fat from the tummy or the back to make a waist very, very narrow, and we can graft it in the bump. We do exactly the same thing with the breasts. We can do to give more shape. We can do it to elevate a little bit, to do a little lift. And we can also do it to cover the breast implants when they start to be visible. Of course, we do it all the time for breast reconstruction during cancer. And today, or from a very long time ago, we also use fat to reshape the face. As part of the aging process, the compartments of fat in the face collapse, and then we can use that fat to relift the face. So fat transplantation is absolutely almost mandatory in a facelift. Now the high-end uses of fat includes injecting fat in the muscles when we do a tummy tuck in order to restore the strength of the muscles. And we can use it as nanofat and microfat to inject in hollow areas around the face or in scars. And we use it to heal burns. Fat is absolutely phenomenal. Now, I want you to ask me why.
Why?
Why is fat so phenomenal?
Why is fat so phenomenal?
Because, Ivan, have you heard about the stem cells?
Yeah, I did a bit.
Okay. So stem cells is a cell that is capable of transforming in any cell. It's a super cell.
It's the same they use for PRP, right? If I'm making a question or not.
No, it's not the same, but it's similar. So it goes into the same direction, but it's not the same thing.
Okay.
Now, you remember when you don't have kids now, but you will. And when you will have a baby, your pediatrician or gynecologist is going to ask you if you want to keep the umbilical cord.
Yeah.
Because the umbilical cord has embryonary stem cells. Embryonary stem cells are the only cells that can become any cell. So an embryonary stem cells can become skin, bone, muscle, nerve, retina, iris, whatever. Okay? But you only have one chance in life to have it. When you are born, cut a piece of umbilical cord and you send it to the bank to keep it for as many years as you can. But your parents didn't get your umbilical cord, right? Mine either. And I didn't get the umbilical cords of my children. So what do we have left? We have fat and bone marrow. And fat is the biggest and the largest container of adult stem cells. Of course, adult stem cells are not as powerful as the embryonic stem cells, but they can develop in several lines. So what we do today is we harvest and then we reuse these stem cells to put it in places in your body where you need regeneration, because the stem cell has this amazing capacity of regeneration.
Yeah.
So we use it in burns, or we use it in scars, or we use it in places that are suffering. Now, as technology advances, now we have machines that are capable to separate the stem cells from the fat and have pure stem cells.
Okay.
And this we can enrich to PRP, as you said before, or we can put it in a bank, in a Swiss bank account, lock it, and come and claim them when you will be 60, 80, 70, and then use them again. And now we're going into more crazy stuff, that is stress these stem cells to have exosomes, proteins, active proteins from this that can be used for regeneration. So for me, this beautiful thing about fat transplantation, let's come back to Earth, to your first question. Let's come back to what can we do tomorrow in any patient, is to remove fat from one side to another side. And that gives a change in the shape, that gives a change in the emotion as well, but it can also give material to keep it for use into the future if it's needed. So that is why it's such an amazing.
What's the most common place you would take the fat from? Is it the belly, or I would imagine, or what?
Not necessarily. The belly, yes, of course, but the belly is my second best.
Okay.
My first best place is the lumbar area, the waist.
Okay.
Because the waist deposit is very big in everybody. And there is, structurally speaking, for a surgeon, there is two big compartments, the superficial waist compartment and the deep one. And both of them are very generous. And the size of those cells is very stable. Now, the fat of the tummy contains cells that can be very enlarged and very small. So they can vary in size. So these are my two favorite places of harvesting. If we're going to harvest fat to transplant to the face, then we probably use the knees, because the fat cells in the knees are smaller than the other ones, and they don't have this changing capacity that is as important as in the tummy, for example.
Your typical patient, when that occurs and you harvest, as you say, you would take the right amount for the surgery, or you would use that opportunity to take more and also reduce fat in that area, or what's the typical procedure?
That's a very good question. That's a very good question, because in the past I will remove only what I needed. Yeah. Now, no. Now I remove as much as I can from a session, because I think in the chances of a patient to have multiple surgeries is very reduced. So it is better to remove an area to the end, So I don't do, but I did it in the past. I accomplished doing 1 hour liposuction or 2 hours liposuction. I don't do it anymore. I do an area complete, finished, and another area complete, finished, and the number of areas that I can. And I can do it because we own the place where it's done. So we don't work against the time, against the prices of what it costs to rent an operation room. We deliver the result, and that makes us very strong.
So talking about time, what's the typical time range? I guess it varies a lot, but like typically, what are the times it takes?
Professional liposuction with 2 surgeons cannot last less than 2 hours.
Okay.
A reasonable one lasts 2 hours and a half with 2 surgeons. With only 1 surgeon would be maybe almost 70% more of time. That is why we do extraordinary liposuctions, because my team, there are always 2 plastic surgeons working at the same time. That reduces the use of anesthesia and the use of the operation room, and makes things far more efficient.
Now, question, obviously, so very humbly, you're one of the best plastic surgeons out there, and this is why happy to have you. And we didn't cover that, but now let me ask you, what are the risks of not going with a very good plastic surgeon for such a procedure?
That is a very good question. Every procedure has a risk. Every single act has a risk. So it is very important when you do these kind of procedures to have it done with someone with experience, because the risk of having a complication, an aesthetic complication for a liposuction, I wouldn't say that are very high. They are moderate high. However, there are a couple of areas that could be very dangerous.
Okay.
And messing with the upper part of the tummy can end up by getting inside by accident inside the tummy or inside the thorax and produce a severe problem. And also everything that is lipotransfer to the bump can be very dangerous if it's not done with someone with experience. I would like to say that if you're interested in these kind of procedures, it is very important to address yourself to a plastic surgeon who has experience on that, who does it frequently and who does it all the time. This is the kind of surgeries in which the credentials of the surgeon really matters over the money.
Yeah. No, I think it totally makes sense. That's why we're happy also on our platform to have like a full description for each doctor.
Yeah.
We tend to handpick every doctor that's there. We also have this new feature where you can search by doctor and rating. So you'll find this out in the coming weeks. And it makes a lot of sense. I also heard of liposculpture. What's the difference between liposculpture and lipotransfer?
Lipotransfer and liposuction are basically the same thing. Liposuction is the art of sculpting the body by removing or adding fat. And the big difference, really, what probably you want to ask is what is the difference between a liposuction and a liposculpture?
Yeah.
The liposuction is the process of absorbing the fat. And that has changed dramatically in the last 20 years. 20 years ago, we were afraid of liposuction because liposuction used big tubes, very aggressive, with high negative pressure. And when you are violent against the fat, you disrupt the vessels that are there. And that makes the client, the patient, lose a lot of hemoglobin. So there is a limit of fat that you can remove. That's a classic liposuction. Liposculpture is the art of liposuction.
Okay.
So the art that have brought us what today's surgery is capable of doing. So we can remove massive amounts of fat without the risk of the old liposuction because we use minimal invasive cannulas. We reduce the pressure, and what we want to do is preserve the nerves and preserve the vessels that are in the fat, that are in that place. So the procedure is far less aggressive. The recovery is much quicker, and the risks are much lower. So I'm fascinated about this. I can talk about hours for that. But what you need to know is, for example, it was dangerous to remove more than 4 liters of fat in the past because of the chances of lose a lot of blood inside. Today, 4 liters is not much. You see?
Really?
Yeah.
Well, I have zero clue. So how much do you think myself I have fat in my body that you could? 4 liters seems a lot. Like it's crazy.
Yeah. But in a person slim like you, we can easily remove 800 or 900 milliliters from your back only. Then wow. You will have another 800 in your thighs. Maybe you don't have much in the tummy. That's why the tummy is not my favorite place, you see. But I have a lot of patients like you. I have a lot of patients like you, super slim, that eat well, that do a lot of sports, etc., that need these cells for lots of reasons. I give you an example that is very funny. I have a lot of bodybuilders and coaches that make their job is to take you out to run with them and to do push-up, etc. And they come because there is a deposit of fat in the waist that it does not go. It's a doctor, I eat well, I exercise, I don't smoke, I don't drink, etc. But this fat cannot go. Of course, and it will never go. Because this is a deposit of cells that they are already empty. They cannot get emptier because they don't have more fatty acids. It is tissue that cannot get any smaller. In that place, there is an excess of empty cells. So there are cells that are piled one to the other. And you are not programmed to kill your own cells. So you cannot turn and say, die and disappear. You can't. So the only thing that works is mechanical removal. So for example, in this kind of patients, there is a non-invasive technique that is cryolipolysis. It's called cryolipolysis. So you put a machine to freeze
That's also called cool sculpting. Yeah. I've done it at your clinic, also at Le Mans clinic. It works a bit.
Yeah, it works a bit.
Yeah.
With one condition, it has to be fatty acids inside the cell.
Okay.
If there is no fatty acids inside the cells, the cell cannot freeze.
Okay.
So I was going to tell you a story about a marathon runner who came for that problem. And this marathon runner said, I do 3 marathons per year. Look at me. He's super thin, but with a little bit of fat deposit in the waist. Okay. So I said, do cool sculpting. In 45 minutes, the problem is gone. So we did once. We didn't see anything, just a tiny change. We did another one. We did a third one. And I said, look, sorry, I was starting with cool sculpting at the time. I say, no, there is no result. You can do 1 million sessions of cool sculpting and you can run another 20 marathons. That is not going to go. We have to mechanically remove it. So we went to the operation room, 40 minutes because it's a very small area, remove it with micro liposuction and the problem is gone.
For an example like that, roughly how many liters did you take?
Oh, yeah, we were talking about volume. Yeah, that, for example, that would be easy, harvest 300-400 milliliters per site.
Wow.
That's what I told you, that when I do a waste, I'm always amount between 800 to 1 liter. It's a very beautiful deposit of fat.
We've seen many examples. I've seen some pictures of badly done breast surgeries. Well done. Then there are some implants that would be visible implants, others that are natural. What do you think is your recommendation? What are good cases of breast surgery? Because it could be augmentation or reduction as well. Enlighten me on the subject.
Well, this is a very, very, very fascinating subject. I love breasts. And after that, I love breasts. And after that, I love breasts. And breast surgery is a passion for me.
Yeah.
Now, it's a big chapter of plastic surgery because we're going to speak about breast augmentation to talk about implants, for example.
Yeah.
Right? Breast augmentation can be done with 2 things, with fat, we already talked about it, and with implants.
Yeah.
Now, if you're going to choose an implant, the shape of the implant depends on the amount of volume that you want to insert. For example, today we have a technique that is absolutely phenomenal, that it's called minimal invasive breast augmentation. And the minimal invasive breast augmentation is made to preserve everything in the breast, to do not destroy the vessels, to do not destroy the nerves, to do not destroy anything. With one condition, we put a very small implant. And that is very nice. We use implants that are small, that are so small and so elastic that we can place it, basically injecting it through a very small incision. So if the client is seeking for a small augmentation of one size and a half, let's say in volume, maybe between 150 to 250 milliliters, a minimal invasive breast augmentation is the response.
And post-surgery recuperation is much faster.
Zero.
Zero.
You do surgery on Friday, on Monday, you have a normal life.
Wow, that's really interesting.
Yes, it is amazing. It is absolutely amazing. And it preserves everything.
Yeah.
But it is very simple to understand. If you have a tissue that is like a hammock to hold the implant, if it's an implant and a small implant, the tissue will hold. Super simple to understand. Now the problem, and then we have discussions between me and my peers, is everything that goes over that volume, when it's a more serious breast augmentation. I think that I'm passionate about this subject. For everything that is over 280, 300, with a patient was an increase of more than 2 sizes, then I prefer anatomical implants. Anatomical implants are implants that are already have the shape of a breast.
Okay.
Some people call them teardrop implants, gummy bear implants, etc. So I use anatomical implants a lot, and I use anatomical implants that are super special, that have a fixation system, so the implant cannot turn, cannot flip, and cannot slide down. And this is going to brings me to the most important part of the discussion. When you put a nice round anatomical implant, with time, it looks fantastic for the first year, for the second year, but little by little, the implant starts to slide down. And that generates a deformity that is called bottom out. Bottom out is when the implant is up, is great, the nipple is in the right position, and little by little, because of the weight of the implant starts to go down, 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 and elongates the lower part of the breast.
After how much time does
I would say that it depends on the implant, of the quality of the implant. I would say that with the new implants that are micro-texturated, that the surface is not very grasping, that happens in year number 2 or 3.
Wow.
And I dislike that a lot.
Yeah.
I am a little bit of a perfectionist in that matter. So I have a bet with some of my best friends, plastic surgeons, that believe that that is not happening. I have a bet like in 2 years or 3 years time from now, with a bet that was made 2 years ago, we're going to have a lot of revision surgeries of these implants falling down. I don't have that problem, Ivan, because I almost only implant implants that can be fixed, so the implant cannot go slide down, cannot turn, and cannot flip. And that has given us an amazing success. I inclusively make a satisfaction study for the last 15 years that I have done. And the results are very different between the use of teardrop implants and round implants in the terms of satisfaction rate.
How much time should an implant last? For life, forever? I have no clue about the duration it should stay.
The implant depends on the technology of the implant. There are implants that are made of cohesive silicone, and those implants may last more or less 10 years. Statistically, the implant those cohesive implants of cohesive silicone, those implants can start to sweat silicone through the capsule of the implant in more or less 8% after 10 years. And it's a microscopical sweating. So if you carry those implants, it would be good to change them from year number 10. If you are carrying liquid silicone, that these implants were implanted like 80 years ago, to 1980s or 1990, okay. Liquid silicone, those implants can be dangerous because if they break, the silicone can migrate very easily. Oof. So those, it would be important to have them changed year number 10 at least, for sure. But now it's 25 years later, you see, and I still have patients that come with those kind of implants and never have a revision. Then today's implants that are almost unbreakable and the silicone is made on monoblock, maybe they will last 15, 20 years. Wow. But it is very important to understand that regardless of the implant that you wear, your surgeon should follow it up with an ultrasound every year.
Every year.
So we have a program in my clinic. Luckily, my main clinics are in Switzerland, and this is covered by the insurance. We do a follow-up of the implant every year to make sure that it's not ruptured, that it's not leaking, etc. I have amazing stories, of patients that come from the yearly control, and I check, and it's wow, a fantastic result, super nice. And the implant is broken, and it has broke for sure in the last 12 months because my previous exam was fine.
Thankfully, you did it.
Yeah. Yeah. So it is absolutely great to have that. And is my message for all the patients who have implants is, girls, have your implants checked. Even if it looks fantastic, there may be a problem in the implant. And then solving problems like the silicone that is free inside the cavity going to the lymphatic nodes, it is more complicated to treat that rather just exchange a broken implant.
Yeah, that was my thought, is that you might actually not know, right, if something's broken or whatever, if you don't do the checkups.
Yeah, I'm a little bit drastic in my practice. In my practice, I check everybody once per year.
Yeah.
But if a patient is in year 12, 13, I check the implants twice per year. Because I think that it is not a great idea to have a broken implant in your breast.
As viewers love anecdotes, do you have any anecdotes of like a bad case scenario where you had to treat a severely broken implant that wasn't noticed or something like that?
I have many stories, but the one that comes to my mind right now, it's a patient who came from another country. He was only visiting a weekend and had an accident in a hotel. In the day before she came to my practice, and she wanted to sue the hotel. And it was a very a small accident. The wind. She was in a terrace, and the wind elevate an umbrella, a parasol. Oof. And when the umbrella landed on her, and she fell to the floor and hit the implant. So she wanted to make sure that the implants were not broken. So we did an analysis. She needed the medical certificate to fill a complaint. So we did it, and we discovered a bilateral advanced breast cancer. And when I received the results, that was the day after, my radiologist said, this patient needs urgent care, urgent, like now. So I contacted her and I asked her to go back to her country and have immediate treatment. And of course, thank God for the umbrella that dropped on her back, because that was a call to check. You see, she came back 6 months later, completely treated, cancer-free, reconstructed.
The implants were intact. It was just that you discovered at that same time that
under control.
That's insane.
It's unbelievable, isn't it?
Life makes things sometimes that's unexplainable. If the umbrella didn't hit us, who knows what would have happened?
It's a beautiful story.
Yeah. I'm curious, what's the typical age where you get the most patients that are doing breast surgery?
Yeah, I have studied that, of course. Let's say the highest chances to do a breast surgery with an implant is between 35 to 50, more or less. And that includes two things. If we go to the detail why. The first is that we calculated the average time that it takes a person to take a decision. And the average time is, what do you think?
Between the consultation and the action?
No. Between you wake up in the morning and say, I need a boob job, to the action.
That must be a matter of years, I think. I would imagine, 2 years? 5? Wow. 10?
The average is between 7 to 10 years.
Wow.
This is the highest case scenario, right? I'm on the group from 35 to 50. So why they convert more is because these patients have at 35 the means to do the surgery. Yeah. Or they have had children already and they want to restore their femininity, or they have broke up and they are in a divorce or separation process and they want to retrieve their auto-esteem.
Yeah.
So these three factors, that is being able to pay it, post-children, and changing partners, are the most driving, at least in my study.
That's super interesting.
Yes, it is crazy interesting. Everything that is before, like from 17, 15 to 30s, are patients that needs to ask help, dad, mom, grandma, whatever, to do the procedure. And some patients suffer a lot. I have seen amazing miracles for breast augmentation of patients that have absolutely no breast whatsoever, and that have a serious impact in their femininity, in their sensations and their emotions. And I have seen patients that call me a year and a half after, to send me photos of the weddings and then send me photos of the children. And I'm not saying that a breast augmentation is always positive, but almost always is positive. And it is a real experience that makes a massive amount of happiness to a lot of people. And I think that of every single procedure that we do in plastic surgery, breast augmentation is by far the one that has the highest emotional impact.
To close the treatment topic, we're going to discuss about one which we've discussed a lot of Dr. Maddy, is lip augmentations, because as you said, as price is often a matter, so lips is more affordable. There are more, and there are more of good and bad, right? We see it in the streets. So in Dubai, there's a lot of not greatly done ones. What's your thoughts about that first?
We practice a lot of lip enhancement, and luckily we never went in my clinic into these massive lips. Some people call them Russian lips, or this trend to have massive lips. And it's interesting that you're asking this, because the trends have changed dramatically in the last few years. A study was released 2 weeks ago that demonstrated a 40% decrease in using fillers in the world. So in the last year, in 2024. Wow. So all these demands of doing massive lips are in decrease. We don't suffer for that because we never did massive lips. We did only natural enhancements. I was always being against that. And I think that the media play a very important role on this. You know, the girls were influenced by Instagram, Facebook photos, TikToks with massive lips. And there were a parallel black market also of offering access to having this done with very, very low prices, done in hairdressers' rooms with people that have no licenses. So that trend, luckily, is changing because girls are going back to natural. I'm so happy. You know, it's funny that you asked this because luckily, when the injection is done with hyaluronic acid, there are serious risks of having serious problems of necrosis, even blindness. I have seen blindness, thanks God, never, but necrosis, yes. And you need a doctor that is capable to identify the problem and treat it. That is very important. But recently, I have treated patients that have injected hyaluronic acid that was meant to be injected in the buttocks or in other places of the body. And in certain countries, just for the means of paying less, they take this super heavy hyaluronic acid and inject it in the face of poor patients that do not understand what I buy.
Just because it's cheaper, right?
Just because it's cheaper. And then these cases ends up in surgery. There is no other solution than surgery. I did two. Only this year, I have already done 2 chelioplasties. Chelioplasties is the plastic surgery of the lips to remove this kind of products that do not dissolve, that become a very serious problem.
How long are these operations? I imagine it's huge. It spreads, or how?
For me, it's scary in the sense that you cannot warrant that the result will be great. And messing with the lips is complicated. And luckily, I'm a very conservative surgeon, and I've been very lucky with my patient selections and the expectations that I give to them. The results, I'm extremely satisfied with the results, but it is a shame that the patient has to end up by having to operate the lips for injective things that they didn't know what they were, or they were sold a dream that it was going to be fantastic. But the association, the common ground of these patients is wanted to pay less than possible, and wanted to have the best result than possible paying less. So they ended up in the operation room, you see, and it's very sad.
I don't know how much you have of that in Switzerland. One thing I noticed here, so as we were onboarding some clinics, we had catalogs and we'd look at the price, and a massive red flag for us would be if prices are too cheap. Because too cheap, and that's what we've learned from different clinics, is that they use counterfeit products, like fake products. As the same as you have like fake luxury brand, you also have fake injectables.
Oh yeah,
that's crazy.
Yeah, there are companies that luckily haven't happened to me, but there are companies that are coming to buy the envelopes of the boxes where the expensive hyaluronic acid comes. They come and buy you what you threw in the garbage, you know. And obviously, what they want to put fake hyaluronic acid in luxury boxes. It's like if you buy Hermes, and then somebody comes and say, "Can I buy you the box? Only the box?" You know.
And then they put the fake stuff inside. Yes. This is crazy.
Yeah. So the market is crazy. Unfortunately, the praise are young girls that want it and don't have the means to pay it. So they are going to do whatever it takes to have it done, exposing their health and having severe complications in order to obtain something that is absolutely irrelevant. It's beautiful to have beautiful lips, but it is not absolutely necessary. You know, obviously we know that the beauty is within. However, in my clinic we address that problem. So when we have a young lady that visibly wants it and we want to help, then we can do something like inject a portion of a dose to match the money that they can put, or ask the patient to pay in installments. So we will find a solution. But what we don't want is to go to a back door, you know, on a nasty place and have an accident by being injected by someone without a license or with a product that is clandestine.
Talking about new patients to aesthetic beauty, do you see a lot clients that come that want a specific treatment just because they've seen it on social media, but it isn't necessarily what they need? Do you have these cases often?
Of course, and there are patients that come and say, "Hi, doctor, do you have this Nefertiti thing or the foxy eyes or the..." Because the media feeds with information that goes much faster than the doctor's information, you know? So you have to check, translate what they want into medical, you know, vocabulary to understand what exactly are asking for. Sometimes they said, "Do you have the last CEO's 32 thing?" And I said, "Okay, so what technology is it?" "No, I don't know, but do you have it?" And then I have to find out what they're talking about. Is a laser? Is a radio frequency? So I am a little bit different. I don't buy technology or things because of the name. I buy technology or machines because they work.
Yeah.
And I have made mistakes in the past, but branding is important for a certain group of people. But we prefer to offer something that really, really, really works. And I think that, unfortunately, there is a massive power of communication and media in recommending a treatment that we don't even understand what it is. But I don't fall in that trap. You know, my real, our really dogma is to provide services that really work. And we go beyond to that because luckily we are a clinic that has doctors in most of the branches, or associated doctors in more of the branches. If we cannot succeed to obtain a result, we can consider what the patient has invested in order to go to the next solution. You see, and that gives a lot of security.
That's great. Look, I think we're coming to the end of the session slowly. Thank you so much, Dr. Tenorio. I have a little token of appreciation, which is the cap we give to all doctors
Thank you
who
very much.
participate for the Dubai Sun. I know you play polo, so it's going to be perfect for you.
Thank you very much.
For all the viewers, thank you for having watched the entire podcast. Please go check out Dr. Tenorio's clinics. If you are in Switzerland or are visiting Switzerland, they're all available on the Aesthetic Links app. Download the Aesthetic Links app as well, and don't forget to subscribe, and also, of course, follow Dr. Tenorio's channel, which is going to be tagged just below. Thank you, Dr. Tenorio.
It was a real pleasure. And
Likewise.
good luck.
Thank you.